Have you developed acne while receiving cancer treatment for breast cancer? In this video, I'm going to be talking about chemotherapy and other treatment-related acne, especially in the treatment of people with breast cancer. Before I go on, I want to invite you to subscribe. This video was inspired by a comment from one of you, so thank you if it's you, and if you have ideas for videos, put them in the comments below. I also want to invite you to go to Yerbba.com to get your personalized report. You might be wondering, are these treatments or is this a possibility in my breast cancer treatment journey? Yerbba will take all your medical records once you give us permission to access your records or you upload them. And what we do at Yerbba is go through your medical records, create a summary of everything we know about your breast cancer and about you, all the treatments and tests that you've had, and then show you the treatment options that you might hear about and some that you might not even have heard about when you go to your doctor, including the pros and cons and questions that are completely appropriate to ask your medical team. All right, so let's say you're going through breast cancer treatment and you have acne and you're thinking, what is going on? I'm not a teenager anymore. There are several things that can cause skin problems that are acne-like or can sure resemble acne. The most common thing is steroids. Corticosteroids are the most effective treatment in preventing many of the serious and common side effects of breast cancer treatment. For example, nausea and vomiting is effectively prevented with corticosteroids as well as some other medications. So they're really part of the mainstay of making sure you don't get sick and nauseated during and after your cancer treatment. Steroids are also a really important part of preventing reactions from drugs like paclitaxel, the brand name for which is Taxol, and other medications, including immunotherapy. So steroids are, the bottom line, a really important tool for helping treatment be more tolerable and safer. But corticosteroids can also cause acne. So if you've been on corticosteroids like dexamethasone and you get acne, especially on your face or your chest or your back, it may be from the steroids. There are other medications that can cause rashes that you might think are acne, but are actually a drug reaction. If you get these, you can actually take a picture and upload them to your doctor's patient portal, and they can tell you what you need to do or if you need to be seen. Something that's really important to mention is a rash from immunotherapy is very serious, and if it's really red or causing other problems, there may need to be a treatment intervention made. So if you develop skin changes and you're on immunotherapy, it's really important to get to your medical doctor. You can send a picture, but let them know you're having problems. Don't wait for your next medical visit. So in addition to letting your medical team know, what else can you do? Well, one key thing to do is make sure you're not using any key new products like laundry products or lotions. You could be having a reaction. Make sure you're using fragrance-free and really simple products. Like look for only 2 to 3 to 5 ingredients in your skincare. You want to give as little irritation to your skin as possible. Be really gentle with your skin. Don't rub at it, even if you want to. Don't pick at your skin or try to pop any acne lesions. You want to be really tender to yourself, not just around your skin, but everything else, of course. You also want to avoid sun exposure. Be careful not to be out in the sun when you've had chemotherapy. We have a whole video about your skin and cancer treatment, including radiation therapy. So make sure you're staying out of the skin. When we're younger, going out in the skin can actually help acne, but when you're undergoing cancer treatment, we do recommend you avoid the sun. There are other things that can be given. Antibiotics, either topically or oral antibiotics, can be prescribed. If you've been on these in the past, make sure your medication is not expired, because some of these antibiotics can be unsafe if they're older than a year. You can also try using things like benzoyl peroxide on your skin. These are over-the-counter or prescription forms that can help clear up that acne. I hope this has been helpful. I've covered a lot. Drop a comment or a question below. If you have a dermatologist who's prescribed something natural over the counter, made recommendations, drop it in the comment for others in the Yerbba community. Thank you as always for watching, and we'll see you next time.